what is one piece of advice that you would offer to patients diagnosed with a thyroid nodule today?
So a lot of people are very anxious about thyroid nodules. It really creates a lot of anxiety. And in fact, it's kind of funny because I have this philosophical discussion now that I didn't have years ago. And it's the advent of high frequency ultrasound or high definition ultrasound has identified nodules and these problems in the neck that people never knew they had in the past.
Right.
And so as a result, there is this tremendous increase in diagnosis of thyroid cancer because of this high definition or high resolution ultrasound. And so we're seeing a lot more thyroidectomies, we're seeing a lot more biopsies and that stuff, the stuff that never happened in the past. And so it became known as the epidemic, or the thyroid cancer epidemic, that it was just the incidence of cancer is exploding, and it was really all about basically identifying it very early in its process. A lot of these people would not even know that they had it.
Right.
But a thyroid nodule, if it's big enough, they should biopsy it. If it's symptomatic, we should treat it. Mm-hmm. And basically, once you biopsy it, and all the biopsying technologies are so much better than they used to be to help define if it's benign or cancer. Lesions over a centimeter should be checked. Over 2 centimeters if they look relatively benign. And all the guidelines for the ATA are changing to be less prescriptive in terms of biopsying everything. So there's going to be less surgery, less biopsies, less follow-up, which is good.
Right.
But if you have a symptomatic thyroid nodule, though, the chances of it becoming asymptomatic is pretty much zero. So if the nodule's big and it's causing symptoms, then those are the ones that we want to treat.